All right, continuing on. Our next speaker is Chastity Mays. Chastity is co-administrator for the Little Resource Center in Carbondale and is a certified birth doula. She has been working in family service and peer support spaces for over 15 years. She has served clients in Southern Illinois, the Missouri Boot Heel area, and Paducah, Kentucky. She stands with and advocates for families who are underrepresented in, and in many cases, simply not heard at all. Chastity is routinely involved in state and regional political efforts around Black maternal health and frequently presents her expertise and experience in public forums, conferences, and through legislative testimony. Chastity believes that representation and cultural awareness is vital to changing the exorbitant Black mortality rate. Chastity?
Thank you so much for having me here tonight. I really appreciate it. As she stated, I am a birth doula, and I've been a birth doula for 6 years now. It is absolutely my passion to serve families, and I don't think people understand the crucial role that doulas play. What we do is we provide like a grassroots level of care to the families. So we are not medical providers, we're support. So I provide emotional support, education support, and physical support to my families. The way my services work is I meet the family where they are. I meet people when they're peeing on the stick. And then I also meet them. I have went into the hospital when I've never met the family before, but they need that support. So the hospital has called me, a family member, and I go in and provide that support. I usually try to have 3 visits with my families before they have their baby, and we prepare. And then I go in the doors of the hospital with my clients. I stay with them until they have their baby, and then I stay 6 weeks postpartum. So these are actually my doula clients. These are real families. I have a relationship with all of them to this day. So if you look at this couple on the bottom right, their son is 3. She just texted me last week, Chastity, he hit his head, what do I do? So just having that support from someone that you can reach out to is really crucial and key. Something that was a big eye-opener for me was the amount of times I have been the only person in the room with that mom having a baby. There's no family. There's no one. Even when I ask them, who is the emergency contact? If something were to happen, no one. So you have to realize how critical doula services are. It's really, really important to families. Something else I'll tell you is last week I had a consultation with a young couple. They're 26 years old. They recently lost their food stamps and they're struggling to eat. So as doulas, we provide them the resources that they need, which is a food pantry, right? They need food right now. They both work. These kids do not have food, struggling to eat, working. They just don't make enough money. You also have to realize that these families having Medicaid is so crucial. I have families who have had a preeclampsia and stayed in the hospital in St. Louis, 2 hours from where they live, for months at a time. That means their families are stretched. Their families are having to go visit them. Somebody usually just stops their life. Usually it's like a grandma, they're able to do that and just goes and stays with these families. If somebody has preeclampsia, usually they're having their baby early. That means you have a baby who's in the NICU. If they did not have Medicaid, what would they do? We also have a huge Spanish-speaking population in Carbondale in Southern Illinois. And the immigrant population does get an emergency card for them to be able to have their baby. But a month after that, 30 days after that woman has her baby, she has no more services. That means she does not have food stamps. She does not have WIC, which my other clients have WIC to supplement formula, right? She cannot get those emergency diapers, wipes, those different types of services. Losing these critical, important pieces for a family is just devastating. I always say, if we're not taking care of our moms and our babies, what are we doing as a society? We have to put them first because these moms need this care. We have gestational diabetes is on the rise. And you guys, this is everybody. This is no matter who you are, white, black, yellow, gestational diabetes, preeclampsia, all of these things that are affecting families. And then now, if we're saying they have preeclampsia, they have gestational diabetes, now we're taking their food away. What are they supposed to eat? That means they're not eating healthy. They're not eating fresh foods. They're not getting the services that they need. So looking at these real families who I've served, who I still have a relationship with, realize that they may be losing their services. Can you move it forward for me? These are just some other of my families. The main question that I get after they have their baby is breastfeeding questions. If you take a look at the bottom right, we stayed up all night with her, just providing support. That's the picture we got in the morning. She was like, look, I got all this milk. So that was super amazing. So we are, as doulas, we are actually now in Illinois able to take Medicaid. So we provide, for these families, our services are free. We are able to do that now for a full year. So we provide the support while they're pregnant, labor and delivery, and then a full year postpartum. You can move it forward. Now, I do want to let you know that this was surprising for me even when I first became a doula. The United States ranks worst in maternal care in the entire world. That for me was like, what? We're supposed to be this great nation, but we're not serving our mothers. And if we're not serving our mothers, we're not going to be here anymore if moms aren't having babies, right? Like we all were born. All of our moms brought us into the world. So U.S. is worst. I will say that the best countries have midwifery care as a basis. And our country has obstetricians as a basis for our providers. That's the difference. Midwifery care provides that community level of care that a doula provides. So they're meeting the family where they are. Like if somebody has a home birth, their visits are an hour long. When you have a baby nowadays, you go to the provider. First of all, you never see the same person. You see a different provider every time you have a prenatal appointment. Then when you go to the hospital, whoever's on call is who delivers your baby. Sometimes my client has never met the person who delivers their baby. Then nurses switch shifts, right? So we're on 12-hour shift, but that doula, I'm with you from the time I meet you until the time you have your baby. So that consistency is really important for clients. So yeah, this is key for people to really grasp and understand that we really need to do better with our maternal care for mothers. Something else I'll tell you is that all women are not listened to. All of them. Like I have clients and they call me and they say, Chastity, I just really think something's wrong. As a mom, you know when something's wrong. You know when your blood pressure's high. You know when something's wrong with your baby. They go to the doctor. Oh, you're pregnant. Well, I feel faint. Oh, you're just pregnant. It's not always pregnancy. Sometimes there's something wrong with the mom that needs to be taken care of. So if you would move to the next slide for me. So the reason why Black women are dying is in a hierarchy, we're just at the bottom of that totem pole. So if you're not listened to, I'm actually ignored like I don't exist. So when I go to the doctor, I might be drug seeking or, we just don't believe you. You don't know what you're talking about. So that's why Black women in Illinois are dying 6 times more than their white counterparts. And sometimes the reason is just racism. They just simply overlook our concerns and don't believe us because as doctors, sometimes they're just taught not to believe Black women. 72% of the deaths are preventable for Black women. I think the most impactful case for me was I had a teen client, and I always tell people, families just don't know what they don't know, right? As a doula, if you call me and you say at 20 weeks pregnant, you're swollen, that's not normal. That should not be happening. But her family, you know, her mom, her aunt, oh, it's okay. You know, you swell when you're pregnant. No, honey, not at 20 weeks pregnant. I even told her to go to the doctor, and they told her she was fine. I told her, send me a picture of your face. She sent me the picture, and I said, either your mom takes you right now or I'm coming to get you. We got to the emergency room. Her blood pressure was at stroke levels. They were able to get it down. She ended up in St. Louis for 3 months. That happened again 3 more times. She called me. I was able to get there. I was there for the birth of her baby. Her and baby are doing amazing. But if she didn't have a doula, I remember we were at the birth, her dad cried. And she told me, thank you for being here for us, because we don't want to think about what would have happened if you had not told us to be there. And part of Medicaid, part of insurance is having a doula for families. If you go to the next slide for me. And I always tell people, I love this quote from Audre Lorde, I am not free while any woman is unfree, even when her shackles are very different from my own. This is everybody's issue, you all. Like I said, mothers are so important. We have to take care of our families. We have to make sure that they have food. We have to make sure that they have housing. We have to make sure that they keep their critical insurance. If these families, like think about this young couple, 26 years old, they're struggling to eat right now. If they lose their insurance, what's going to happen to her care? She's pregnant right now. She's not due until next year. If they were to have a deductible that went too high for them, she might just decide that she doesn't want to have this baby, or she doesn't have insurance. And then sometimes when someone doesn't have insurance, they don't realize you can still go to the hospital. They're still going to serve you, right? But there are some families who don't understand that. So they're not going to go to the hospital. They might be at home bleeding and scared to tell anyone. So we have to really, really take into account this is everyone's problem. If you don't know what a doula is, educate yourself. If you know someone who's pregnant, please tell them to get a doula. It doesn't matter who you are. Man, woman, young, old, black, white, and everybody in between. Please, please think about mothers and think about who you vote for makes a difference to everyone in our country. Thank you.